Hello everyone. I felt like the best way to show what biofeedback is would be with a short video clip, as a still picture in the presentation and my words would probably not adequately describe it for all of you, and it really is an important treatment modality that we use in physical therapy. The entire setup includes the computer with a software program, the biofeedback machine, which is the little box on the right hand side, and then either a vaginal, which is the white electrode that you see towards the back of the table, or surface electrodes, which you see towards the front of the table that are red and green. We typically use the vaginal electrode most often because it picks up that deeper layer of the pelvic floor or the levator ani, but we do also use the surface electrodes around the anus depending on the treatment goals, or sometimes placed on other accessory muscles that someone might be substituting with. And once we have an electrode hooked up to the muscle, then the computer will pick up that muscle activity for us and graph it on the screen. And so the lime green that you see firing up on the top is the pelvic floor, and the royal blue on the bottom is set up on an accessory muscle group, and it is meant to stay quiet and not go up and downhill like the top screen, because you're trying not to use those muscles when you should be isolating the pelvic floor. This is currently set up with a work time of 2 seconds and a rest time of 4 seconds. That can be individualized for each patient depending on their treatment goals and where they are at in their pelvic floor work by second increments. And I typically will cue along with the program to help the person so that they're getting visual as well as auditory cues, but you can also set the volume on the machine to give auditory cues that way as well. It's just a very helpful program because the pelvic floor muscles are small and often hard to feel, and so it allows people to see what those muscles are doing.